Hi, everyone. Welcome back to the Kind Health Group YouTube channel and podcast, COVID-19 edition. It's Martin. What day is it? I always think every day is Monday. It's Thursday,
March 26th.
March 26th. Yes. Hi, Annie.
Hi, Dr. Nanos.
We have a special guest coming up with us in a few minutes, but Annie and I just wanted to say hi, and we're going to change the format a little bit. Instead of doing separate little updates, we're going to do updates in the beginning of each episode and then go on for a longer stretch with our special guests. We have lots of guests. We actually had recorded a whole series of guests before this started, and Annie and I were joking this morning that we should have them all back on in a post-COVID world because they were great guests and they have lots of relevant things to say. We had great recordings last time, and now this time, after all this is going on, it would be great to have them back. So Miranda Chavez is the Integrative Services Program Manager for the Community Resource Center here in San Diego, which serves a lot of our homeless and underserved population. And she's here to talk about how this is impacting that population and things we can do to help. And tell us a little bit about what you do at the CRC, and let's go from there.
Okay, so I serve as the Integrative Services Program Manager. And what does that mean? It's we provide services to folks who are experiencing homelessness or low-income families, seniors, pretty much anybody who has a need. We provide everything from case management to food services, rental assistance. We have a winter shelter. Here we have three case managers, an intake specialist, program manager, myself, and we kind of do it all. A large focus right now is on folks who are experiencing homelessness, especially within the city of Encinitas, since that's where we're located. And we have a project specifically with the city of Encinitas called Encinitas Opening Doors, where we are helping folks who are experiencing homelessness in Encinitas to find housing and connect them with the resources and services that are out there to hopefully get them into permanent housing.
The weight of the world on your shoulders there.
Some days it feels like that, but I have an amazing team. So we work like a well-oiled machine, and so it's a good place to be with the people that I'm here with. So it's good.
Miranda, can you kind of update us on what's going on now?
Oh, so looking at my watch, because it's kind of what it feels like right now. Things are changing, and every time we get a plan in place and we're comfortable with it, then something else changes. So right now we're, so normally we have our food program. We offer a couple different food programs starting at 9 o'clock in the morning, going all the way up until usually like 1:30. But because we want to adhere to the social distancing, we want to minimize folks' exposure to anything, and still, provide them with healthy food and resources. We've adjusted our hours so that we're open for a shorter period of time, but we're doing things kind of at a faster pace. So our food program, where we normally have a shopping experience, folks are able to get the carts and kind of go through. We've adjusted that to just provide some more general food boxes with fresh items and things of that nature, just kind of out the door in a box. So unfortunately we can't provide the shopping model, which we're, which we've been doing for a long time, and it works out well, but kind of just adjusting food that way. We're also working, especially in integrative services here, we are providing motel vouchers, temporary lodging vouchers to some of our folks in the Encinitas community who are experiencing homelessness, just really in the hopes of getting, these folks are some of our most vulnerable neighbors. And when we're talking about sheltering in place, or we're talking about, minimizing our exposure to, the potential, the COVID, these folks don't have anywhere to go. And so we're working with a couple of different entities to provide temporary lodging in partnership with the city of Encinitas. So we have provided about 56 vouchers for temporary lodging as of maybe like 10 minutes ago. So it's we're just moving and shaking. In addition to providing, we're still doing rapid rehousing for some of our homeless folks, so helping them find housing. We actually did have one of our participants find housing, and we were able to cut her rent check yesterday. So while we're providing these emergency services, we're also still doing the work that we always do.
Are these local hotels or corporate hotels that are donating these vouchers? How's this working?
No, so we have a partnership with the city of Encinitas to provide temporary lodging, and they're at a couple different undisclosed locations, but we are partnering with some of our community partners so that we can get folks temporarily lodged.
And I know for the food bank, companies like Trader Joe's and, Lazy Acres, other companies usually donate. Have you seen donations in food go down?
So last week, yes, we were really, really, really hurting for, especially food, fresh food items. So we have a lot of canned items. Well, we did at that point because it was just beginning. So we still had stuff on the shelves, but getting like the fresh fruits and vegetables and meat and things like that we were empty. Friday, we served nearly 60 households through our food programs, and we were just bare. That's changed a little bit this week as the grocery stores start to kind of right size their ordering, and people are calming down on the feeling like they need to buy a bajillion pounds of hamburger at a time. And we're still not getting toilet paper, just like everybody else. So that's kind of we're not getting hand sanitizer or cleaning products, which we would usually get in our food center. But our fresh items have increased. We're also getting a lot of donations from the community, but for a while there, it was really sticky. I would say just over maybe, what day is it even? Today's Thursday. So probably starting like Tuesday is when things seem to be picking up a little bit more. But it was worrisome because we didn't know kind of what we were going to do, but we're really lucky because our community, we asked for donations and they step up too. So that's been helpful.
And what about on the mental health side? I know that can you explain a little bit of what you're normally helping people with there?
Yeah, so we don't have specific mental health services here, but that doesn't mean that we're not serving folks with mental illness. I think one of the things, we all have families here. Most of the people that work in this department specifically, we have kids, we have partners, we have whole households that are at home just kind of waiting on us. And we've kind of chosen as a group to make sure that we're, still here. And part of that is because we do have a lot of folks that are in crisis. People don't always come to CRC on their best day, right? We're here when people are in a bad spot. So we serve folks that are in crisis anyways. So where we have somebody who might be on a, scale from 1 to 10 crisis level, like 3. Well, this whole situation is amplifying that. And people are scared. And even our participants that don't have mental illness or mental health issues, they're scared, and they're, that presents itself in a couple different ways. Folks are angry, they're scared, they're crying, they're upset. They are, they don't want to stand next to each other. And that, we've been working really hard we were able to get some stanchions from the city and make sure that our lines are able to adhere to the social distancing guidelines. And so we're really doing our best to make sure that for everyone, that this is we always do it, but that it's even more a safe place and a calm place. So we're all going out there, and talking to people. We know these people, we know their kids, we know their dogs, we know them by their first name. And so we're lucky to be here because people are in crisis. So I had a guy this morning, that's going to manifest itself in lots of different ways, but he was drunk, and went out there and was able to get him some food. And I'm like, look, I know you're going through it right now. Here's some food. You can't be here like that. Come back tomorrow. And so just letting people know we'll be here tomorrow. If you're having a bad day today and today's not going to work out, don't worry, we'll be here tomorrow.
Are they looking to the CRC for information? Are they turning and asking questions? Do you feel like they're updated on, what the right procedures should be as far as hand washing, social distancing?
Yeah, we're doing our best. So here's one of the things that we're running into, and the folks who are experiencing homelessness. The libraries are closed. The restaurants are closed. Anywhere where they were able to charge their phone or use the computer, those places are closed. And CRC, we can provide the phone and we have a computer, but we're also trying again to, adhere to social distancing rules. And so these folks, they don't have anywhere to charge their phone. They don't have anywhere to get information from, any kind of, reliable source. And so I can't, it's really difficult for them to get information. And so it's a lot of hearsay. And so what we're trying to do is print out as much up-to-date information as we have. And we're taping it on our front window. So we're trying to have like a bulletin board going so that folks know kind of what's going on. But again, because the information changes so quickly, it's hard to kind of keep up with that. But, I think one of the biggest challenges is, the library's closed, no computer, you can't charge your phone, you have no access to communication, the restaurants are closed, so you can't even go in there, you can't go use the restroom, you can't get food, and it's especially difficult for some of our folks who have CalFresh, because they can use their EBT card to access food resources at like Wendy's, but while Wendy's is, they're inside, their dining room is closed, their drive up is open, but you can't walk through their driveway. They won't serve you. So people are experiencing a whole bunch of, it's difficult to experience homelessness, but they're experiencing a whole new list of not great things right now while everybody is going through this crisis. And that's amplified for folks who don't have access to a lot of the same resources, namely a roof over their head.
What do you recommend people can do to help out? I know there's a lot of people in the community, and you had said some people are dropping off fresh, vegetables and fruit.
Mm-hmm.
Is that okay? Is that what you're looking for?
Yeah. So I think some of the things that we can continue to receive food donations. CRC, we have a table set up in the back alley for food donations. What we're doing, we're quarantining some of our food as it comes in, because we're just not able to, wipe everything down as it's coming in. So we have a quarantine system for our food kind of set up. So we're happy to take non-perishable items. We're happy to take donations of money, because one of the things that we're able to do is purchase food from like Feeding San Diego, even, the 99-cent store, so that we can purchase items that we know that we need. So I know right now, when I was over there yesterday in the food center, we're low on peanut butter. And peanut butter and tuna, those are my two staple items that as long as we have peanut butter and tuna, we're good. Well, we're low on peanut butter. So those are some of the more nutritious items that we can make sure that folks are that they have access to. We also had, I wanted to give like a shout out to Philabelly. They're not, a lot of the congregate eating organizations that provide, like they call them feeds in the park where they'll have a congregate meal. They're not able to do that. And so I had a gentleman from Philabelly come by and say, how can I help CRC? I know that you're serving the same folks that we're serving. And I said, we kind of talked for a little bit. He brought me some Chick-fil-A meal cards that I could give out, and Chick-fil-A, I guess, has a table set up out front, so you don't have to walk through the drive-through. You can still be served. And he also brought me some day passes. So as we're providing these temporary lodging opportunities, a lot of folks don't have money for the bus. So it's like, great, here's a motel voucher. I don't know how you're going to get there. So we're taking, everything. Cash is always king, right? That allows us to meet the needs that we're seeing. So any donations to CRC that are monetary and unrestricted are helpful. But we'll take what we can get right now. Our resale stores are closed, so we're not able to accept donations there. So we're kind of working through that as well.
I don't know how much you're working with Carol's House. My question is about domestic violence and people who are going through that at this time. I imagine those situations are also amplified. Do you have any information, or can you speak to that?
Yeah, I can. while it's a separate department, every morning CRC's managers are getting together. We're having our COVID huddle so that we're all, have our finger on the pulse of the organization. And I do know that they've been getting a larger number of phone calls that are coming in. We've been serving some folks through our department that are looking for domestic violence resources as well. And I think that the calls are coming in more frequently, which is to be expected because folks are at home, in dangerous situations. So I do know that there's been an uptick in the phone calls.
And can you just explain real quickly what Carol's House is so that our listeners know?
Yeah, so CRC has a really robust domestic violence department. We provide emergency shelter and then transitional housing as well for survivors of domestic violence. So focusing on not only the emergency, we got to get you in a safe place, but then longer term emergency resources in the form of transitional housing, rapid rehousing assistance, and things like that through our domestic violence department. We also have an education and outreach department that's in partnership with our domestic violence department that goes out to the schools and provides some education that way. And so they're working with the schools to continue to provide those enrichment opportunities for students as they're out.
Great. Another question with regard to domestic violence. Are you having, actually this was more related to near homelessness. So I know you serve a lot of the community that's near homeless. So are you finding that in this situation, I know there's, the law is that people can't get evicted. Are you seeing that truly happening, that people are still able to stay in their homes, or are you seeing new cases of homelessness?
So just because we haven't hit the end of the month yet, or the beginning of the next month, right when rent is due, I'm not seeing a whole bunch of folks who are being evicted or kicked out. I have had a couple of our folks that we have helped with housing, who maybe are renting a room from a landlord, and the landlord is maybe a senior, is maybe not as well informed about some of the things that are going on with COVID-19. And there's some fear there that's like, you can't live here. You're putting me at risk. And it's like, well, you can't really do that. So we're trying to work with participants and landlords to, this is how we stay safe. This is how we stay healthy. But I do think probably towards the middle of April, that if we are, and I hope we're not, if we're going to see folks getting evicted or losing their housing, that's probably when it's going to happen. I do know that we are receiving a number of phone calls from folks who have been laid off, who are already anticipating not being able to pay April's rent. And so we're already getting phone calls through there. We have very, very limited resources. In fact, just with the calls that we've gotten, I don't think that we have any more homelessness prevention resources right now in terms of being able to help with rental arrears. And so we're identifying some other opportunities for that. But that's going to be a huge thing. So we have some folks who are working 2 and 3 jobs just to make their rent, and they got laid off from one of those jobs, and that makes them not be able to maintain their housing. So San Diego County, everywhere, the world, the country is really going to see in the next month or two, a lot of folks sliding into homelessness or being real, real close because they can't pay their rent.
Which I think is really important because the CRC is already serving that community, and that's important to know. It's not necessarily, I guess what people would envision homelessness is. It could be your neighbor who might not make rent, which is now
right.
What is facing.
Yeah.
How's the morale at the CRC right now?
Say that again.
Did you say, Annie?
How's the morale? I know you guys are always, especially you, upbeat, chipper,
Well, so we were talking about that today. It's good. It's good. As far as the staff go, we have our days. It's really, really hard to come and see folks that like I said, we know these folks. We've worked with them. To see them scared is really, really hard. But my staff is so amazing because I think that they all, their hearts are at home too, because they, like I said, they all have little ones, they all have families. and we are working with the public. We're working directly with the public. We're doing our best to. We're not providing face-to-face case management. We're doing everything through our intake window, a lot of stuff over the phone, case management over the phone, which is really difficult because we have good connections with our participants. So when we're not able to sit with them face-to-face, that is difficult. So my staff, their hearts are at home, but their hearts are here also, which makes it difficult, not only with the participants, but with each other. We are all, it's kind of like, well, I'm not leaving if you're not leaving, you know, we're going to stay and I'm going to be here if you're going to be here. And so that's good. And we talked about the world is a scary place. And, you know, I went to Walmart the other night and this gentleman, he was a senior, and his wife, and they were there at Walmart, and he dropped something fell out of his cart. And I picked it up because that's what normal people do. Said, sir, you know, you dropped this out of your cart. And he had a mask on, so I couldn't see his mouth, but I could just see the smile in his eyes. And he looked at me like I had given him the greatest gift in the whole wide world by just picking this thing up. And I went home, my drive home from Walmart, I was in tears because I felt so sad. Being at Walmart was so, so sad. Never going there again until this is all done. My husband's on Walmart duty from here on out. But I realized that one of the things we're dealing with real life here at CRC every day. But the thing that's so valuable about the work that we get to do here is that we're in a position to give people hope, right? So they come here and we're able to say, you know, they say, I can't feed my family. Don't worry, we got you. Let me go get you some food. I'm scared. I have to sleep outside. I have motel vouchers. Let me help you. And even if it's just a smile, I make it a point, my staff, we make it a point to go outside and talk to everybody. You know, sheltering in place doesn't mean that you can't be friendly. It doesn't mean that we care about you any less. We're still here and we're happy to see the folks that are coming, and we want to make sure that they have what they need. So as long as people are coming and we can go outside and talk to them and still be able to provide services, our morale is good. We're happy campers. So it's good. This feels like a safe place to be.
We're very grateful for you.
Oh.
We are. Did you ever get your van? I think you got a van, right?
Oh, that's the story of my life. No van as of yet, but we've met. So, you know, if there's a van coming my way, I'll get it. I'm still working on it.
To catch everyone up, we've known Miranda for a while. Annie and I volunteer at the CRC, and Miranda desperately wants a van so she can go person to person, door to door, cruise the community, helping people. So she really would like a van. So if anyone wants to donate a van to the CRC, now's your moment, right?
Yeah. Well, so we have Supervisor Gaspar. We're working with her to there's some funding for a van, and so we're looking at different ways to make sure that funding goes to good use. We're partnering with the sheriff's department to make sure that we're able to do homeless outreach, and you know, so it'll happen.
We're trying to cut through all the red tape and just get a straight up donation of the van for you.
You know, sometimes it's nice. Yeah.
Well, Miranda, thank you so much. You are a beautiful soul and such a kind-hearted, warm individual. And the CRC is lucky to have you. Our community is lucky to have you. We're lucky to be part of this community and the CRC. And thank you for everything you're doing. Please keep up the good work and give our best to everyone there. And just thank you. A million thank yous.
Oh, you're so welcome. It's our pleasure.
Thank you.
Thank you. Stay safe.